I will share my screen. Okay, good afternoon. Good afternoon, everyone. Thank you for joining us for our webinar today. I am Marisa Crisocco, and I am the Program Director for the UConn tab. And today we will be discussing using public health data to put together multi-purpose assessment and cleanup grants for the FY24 cycle. So the learning objectives for today's webinar is for the participants to understand the evaluation criteria for section 2A2/2 in MAC grants. We want to learn how to use EJ Screen to obtain public health indicators for your target area, and then also how to use supplemental data sources beyond EJ Screen for asthma and cancer data. And I do have a couple of disclaimers in terms of background knowledge that I'm kind of like building on. So today, what I will be presenting builds on the previous webinar presented on October 6th, that is on EJ Screen. And that webinar introduces basic concepts, how you use maps and reports on EJ Screen, and how you identify target areas. So I will be assuming that to work on this section, you have already identified the target areas that have been using the demographics. And the examples that I will present build on those previously used for EJ Screen webinar. And I also want to note that I will have some proposed narratives, some examples of what you could put in a proposal that are not taken from actual submitted proposals, but are more like examples that are put forth by us. Now, that said, if you did not attend the previous webinar, do not worry about it. You can still follow along what we're going to talk about today. And I will show you where to find the previous webinar. So if you go to our website, tab.program.uconn.edu, you can click on workshops and webinars. And the first recording that appears here is the previous webinar that I'm talking about. It's about an hour long, and the PowerPoint is also there, so you can go back and access that information on our website later on. Okay, so when you put together EPA grants, you want to always think about how the reviewers are going to be looking at your proposal. So reviewers will refer to the rubric of the evaluation criteria that are part of the request for applications. So that is section 5 of the RFA. And they will be reading those criteria, comparing the proposal to the evaluation criterion, and then assign you points accordingly. So here we are addressing the section greater than normal incidence of disease and adverse health conditions. And the evaluation criteria for these sections are the extent to which these grants and revitalization plans will address or facilitate the identification and reduction of threats to populations in the target area. So you have to make sure that you put a statement in this paragraph that talks about that. And you may have a similar statement in other sections as well, but it doesn't matter because this sentence appears in the evaluation criteria of this section. You should have a sentence that talks about how your assessment grant or cleanup grant will promote finding out what pollutants are there and then removing those threats to the populations. The second criterion is that you need to be addressing how your populations suffer a greater than normal incidence of diseases or conditions, including cancer, asthma, or birth defects. And we will focus mostly on this second part here. And then note that the criteria also say that if populations in the target area do not suffer from a greater than normal incidence of cancer, asthma, or birth defects, then the response may only earn up to 2 out of 5 points. So you can still talk about other conditions or diseases beyond the cancer, asthma, and birth defects, but you will not get the full points for that section. So we will be focusing mostly on these categories during this presentation. But I will also show you some other public health data. And then finally, you also need to talk about in this section that these conditions or diseases may be associated with exposure to hazardous substances, pollutants, contaminants, or petroleum at your brownfield sites. And I will have a separate slide that will address, this third point all the way at the end. So now we'll talk about how you collect data to demonstrate the greater than normal incidence of diseases or conditions. So there are two types of public health data sources that you can use. The first one is data that is available at the national level, and then data that's available at the state level. So first we will start with the national level. There are three sources that you can use. The first one is EJ-Screen, which we also talked about in the previous webinar. And EJ-Screen presents data at the census tract level. So it shows data for cancer, asthma, and heart disease. And it also shows low life expectancy. So cancer and asthma are two of the main indicators that you will be using. And I will show you what EJ-Screen looks like in a second, but I want to point out that the EJ-Screen data does not come from EJ-Screen itself, but it references this other platform called Places that is from the Center of Disease Control that shows additional information beyond cancer and asthma. So you can get 13 different health outcomes at the census tract level from Places. And then the National Environmental Public Health Tracking Network that I will show you last. It has a variety of information. It's usually presented at the county level, and that's not very useful for you, but it is really the only source that is available to find birth defects. There's no other place where you can address that part. So I will show you the two platforms right now, but I want to mention the following for EJ-Screen and Places so that you're clear how you're writing this. EJ-Screen and Places do not show actual doctors' reports of incidence of cancer. Both of them show what we call prevalence of cancer or prevalence of asthma or prevalence of obesity. So what Places did is it's a national survey over the phone where someone asked a bunch of people several different questions. For example, for cancer, they asked the people, have you ever been diagnosed with any type of cancer except skin cancer by a health professional? So the cause and prevalence that is shown by EJ-Screen and Places is essentially the number of survey respondents who said yes to that question over the total number of respondents. And so they are using that then to extrapolate this to a whole census tract. So I think it's very clear, it's very important to know that these data, when you talk about it, it's not on the basis of doctor reports or actual cancer statistics. It's a statistical model that comes from a survey. So let's see now what these things look like. So let's go to EJ-Screen first. So when you look at the data, you can click here on the left on health disparities. And in this case, I will zoom out a little and you'll see that I'm somewhere in New Hampshire. In this particular case, this is Manchester, New Hampshire. So I can click here on asthma. It will take a minute for the map to show up. Oh, the service asthma is currently not reachable. Okay, that does it sometimes. Of course, when I do a webinar, it's the perfect timing for that to happen. Okay, let's refresh. Oh, now it came back. Okay, I'm sorry about that. Okay, one more time. Let's click on asthma. Okay, very good. So now we see the EJ screen map that shows us, as we talked about last time, all the data in national percentiles. So we can see, for example, that if I zoom in here in Manchester, New Hampshire, I can see everything that is the same color here is a census tract. So if I click on a particular block group, it will tell me that this particular block group is at the 96th percentile nationally. And I can generate a report for that. These maps are helpful when you look at the data visually so that you can tell where the reports where the different hotspots are for asthma. But when it comes to your target area, what you really want to use is the EJ screen reports. And to show you the example of Caribou that we showed last time, I will now navigate to Caribou, Maine. Okay. And we know here that our target area was the census tract 9514. So in this case, I want to generate a report for that census tract. So I will click on my census tract and take the EJ Screen Community Report. And when I scroll down here, it will give me health indicators. So these health indicators are the ones that you want to be using to build your narrative for your target area. So I will return back to my presentation here and show you now how you use this. So, two examples. First one, Caribou. We determined that our target area was census tract 9514. We are looking at the health indicators. And we can see here, we want to look first at the national percentiles. So for asthma and for cancer, we see that the asthma is at the 84th percentile and cancer is at the 74th percentile. Both of these numbers exceed 50. So the 50th percentile is the national average. So in both of these cases, census tract 9514 exceeds the national average in terms of the prevalence of asthma and the prevalence of cancer. So in both of these cases, more than 50 means that you are higher than the normal incidence rate. Okay, so that means that you can use both numbers and you can write the populations in the target area, including people with low income, people with age more than 65, and people with disabilities. These are sensitive populations that we determined in section 1. They disproportionately suffer from asthma. The whole population is at the 84th percentile nationally, according to the EJ screen, and cancer 74th percentile. These conditions are exacerbated by exposure to pollutants found at the site, such as asbestos and volatile organic compounds. This grant will facilitate the removal of these contaminants, directly reducing the health burdens to the sensitive populations. So with these with this small paragraph, I have addressed all the criteria in that section. So I have talked about the disproportionate, higher than 50th percentile occurrence of asthma and cancer, how these conditions are related to pollutants exposure at the priority site, and how the grant will facilitate the removal of these contaminants. This was a cleanup grant. Let me show you another example. This was a community-wide assessment grant from the Chittenden Regional Planning Commission in Vermont. And in this case, they had two target areas. They had the Winooski City, census designated place, as one target area. And the second target area was from Burlington, Census Tract 10. So again, these two health indicators are extracted from the EJ screen reports that we pulled in the previous webinar. And now we are looking specifically at our asthma and cancer numbers. So what I see here is that for both Winooski and for Burlington Census Tract 10, I have numbers for the asthma that are more than 50th percentile. This means that they are higher than normal incidences, and so I can use them in the narrative. For cancer, we have 26th percentile and 35th percentile, and so these are less than 50, and so this means that we are below the normal occurrence. I will point out here that in case your US percentiles are below 50%, but your state percentiles are above 50%, you can use the state percentiles. In this case, we have both the state and the US percentiles being above 50, and so we are better off using the national percentiles because you are competing for these grants nationally. So it is better to use national percentiles. So we can write here, for example, both target areas have asthma prevalence that exceed the national average, with Winooski at the 81st percentile and Burlington Census Tract 10 at the 61st percentile, according to EJ Screen. And then, of course, we would have to say something then about the contaminants and the grant. So here I'm only addressing the higher than normal prevalence. You notice that I don't say anything about cancer or birth defects, but I don't need to do that because I only need one of the three to get the full points. If I have two, that's great. If I don't, that's okay. So what do we do if we look at the EJ screen indicators for cancer and for asthma, and all of them are below the 50th percentile, whether you're looking at the nation as a whole or you're looking at the state? Well, then the first thing that you're going to do is you're going to look for additional state health data sources. And then I will you can also use other indicators that are not asthma or cancer. You're not going to get full points for that, but you're going to get something. So I will get back to this in a second. First, we want to make sure that you have the information on the additional state health data resources that you can look to kind of like build your case. So the first one that you can use is cancer incidence data. This is from the United States Cancer Statistics. The difference, you will have access to this PowerPoint, so you can get the link to this. I will navigate now to the site here. So it is from the Centers for Disease Control, Cancer Statistics, and the difference between this site and EJ Screen is that this reports actual cases of cancer. So the health data here comes from doctors and hospitals. So when you come here at the data visualization tool, when you first land here, you see the United States as a whole. And you will need this information because this is going to be your base level for comparison. So across the United States, you probably want to choose here 2016 to 2020. And the reason for that is that you are better off looking at longitudinal data rather than 2020 data because of the COVID pandemic. So just choose 2016, 2020 here. And you can see that for the whole of United States, your reference value is that for every 100,000 people, 442 new cancer cases were reported. That's the incidence rate, and 149 people died. That's the mortality rate. So for you to see what is happening in your target area, you can only get down to the county level. You cannot get more refined than that. So you can go to state, county, territory, click on here, and then I will navigate here to Maine. And now I see Maine. And unfortunately, I can't really zoom in here. But what you see here is that, for example, for Caribou that I was mentioned before, Caribou is in Aroostook County. So if I hover my cursor over this, I can see that in Aroostook County, Maine had 463 of new cancer cases per 100,000 people. You can do the same thing for all other states, obviously. The numbers here are relative. So the other counties here, for example, Penobscot County has an even higher rate of 526. What you want to do is compare to the national average. So, and as an example here for Massachusetts, I have here that the cancer rate was 448 in whole of Massachusetts, so it was higher than the national average. Or looking here at Aroostook County, Aroostook County had 463 cases per 100,000 people, which is higher than the national average of 442 per 100,000. So it doesn't matter here that the value is less than the state average. It is still higher than the national average, so you can use it to put it in your grant. The weakness here is that obviously your target area is not the whole county. Your target area is a lot smaller than that. But if you don't have anything else that you can use, using county data is kind of like an alternative approach. Honestly, I don't have a great sense of how reviewers are going to give you points for that or not. There's also additional data sources, and obviously it's impossible for us to go through all of those in this webinar, but they are all available both in this slide and also if you go to our website and go under state resources. I will click, for example, here on Connecticut, and all the states have the same outline. So if you scroll down, there is a section called Public Health Data. So that section gives you some general links, but it also gives you specific links for asthma, for cancer, and for birth defects. So for example, for Connecticut here, the Department of Public Health has an interactive map where you can look at different data indicators. This specific one gives you the 5-year cancer incidence rate for any type of cancer for 2010 to 2014. And what you can see here is that, for example, East Hampton, West Hartford, East Hartford was higher than state average. So if your target area is in a town that is orange here, you can say and use that information and say that based on the Connecticut Department of Health tumor registry, all the cancers in the city of West Hartford were higher than the state average. So that is an alternative type of cancer data point that you can use. And similarly, beyond Connecticut, there are several other sources. Massachusetts has its own type of tracking where you can look at maps and tables. It's similar to the Connecticut one. Maine only has county level data. There's nothing beyond that. New Hampshire has data by county and public health region, so it doesn't go down to the town level or census tract level. And then Vermont provides, I will actually click on that and show it to you very quickly. you can click on sub-county cancer data. And look at sub-county data. And now you're going to see kind of like different units. So you're looking for your target area here. And for example, I can tell here that Orange County has higher incidence than compared to the state average. It gives you some numbers here. This county, East, also has higher, so anything that's highlighted in blue from the state of Vermont is an area where you can say that you have higher than average cancer rates compared to the state. Similarly, for asthma, every state has a site that tells you, gives you additional data on asthma emergency department visits and hospitalization rates by census tract and by town. I think that pretty much Connecticut, Massachusetts, and Maine give you town level data. New Hampshire, Rhode Island, and Vermont have county data and public health region data for asthma hospital visits and hospitalizations. So you cannot get down, more granular than that. But it's going to look the same as the cancer platforms that I showed you. So again, you're going to look at values that are higher than the state average for emergency department hospitalization rates. And if you find something there for your target area that works, then you can plop it into the grant. Okay, if nothing else, works, or if you also want to look at the birth defects, there is only a single source. And honestly, I think it's a very, very difficult case to make, but I will show it to you nevertheless for completeness. So the only source for birth defects is the National Environmental Public Health Tracking Network. So let's take a look at what that looks like. Oh, I need to click on this. Let's go here. So this has a lot of different types of data that you can look at. I will not go over them here, but you can see there is one that's called birth defects. And actually, there's no such thing as a general birth defect indicator. There is 13 different types of birth defects. So if you want to see them, you have to look at them one by one. So for example, I will take here prevalence of trisomy 21, or otherwise known as Down syndrome, and say that I want to look at the prevalence is the percentage essentially per 10,000 live births. So I will look at that, and I will have to look at for mothers less than 35 years of age, more than 35 years of age. Honestly, you can spend hours looking at this, and then you can select the geographic type and say that I want to look at state by county, and I want to look at, let's say that I'm going to look at Massachusetts. I'm going to look at 2015, 2019. I will look at all gender and races. And this is what I'm going to get. So for example, here, I will also pull up the legend. Oh, the legend is down here, sorry. So the legend is down here, and it tells you, for example, that this is the top 20%, 20 to 40, 0 to 20, 20 to 40, 40 to 60. So the two colors that are the deeper colors are the ones that exceed the state average. So for example, here, Berkshire County in Massachusetts, Hampshire County and Hampden County exceed the state average in terms of prevalence of trisomy 21 per 10,000 live births to mothers more than 35 years of age. To be completely honest, I think that is a very difficult kind of like exercise to do, to go through all of these different indicators and say how many different types of birth defects you have and so on. But you can do it if you like. Okay, one additional category that I suggest that you look at is the childhood lead poisoning. And the reason that I suggest that is that this is really something that could be actually related to brownfield sites. Like if you have, a lot of like urban fill, if you have a lot of lead paint, and lead dust and things like that, talking about higher rates of childhood lead poisoning is something that it can meaningfully be related to brownfields. And this, of course, will have to be above and beyond the cancer and the asthma rates. So again, this is state-based. So all of these links are available on our website and will be available on this PowerPoint as well. So I will give you here one example. So let's go to Connecticut. Make sure that you see it. So you can look at incidents, and then you can look at town data table. And so you can kind of like scroll down and see how many children had higher incidence. And so you can essentially, you will be able to, there's also a map here that really highlights which of the towns have very high incidence rates. And so you can use that, anything that is kind of like green here, you can use to make a case for your particular case. And similar to that, there are different portals for all the states except Vermont. Vermont does not have the data available online, but there is an email address where you can email them and ask for a report for childhood lead poisoning if you want to use that. The last thing I want to show you in terms of data is I will go back to places. Show you this. So places, it's similar to EJ screen. But it just, so the asthma data here and the cancer data here is the exact same as EJ screen. However, you can also look at a bunch of other different things here, like kidney disease, and this is pulmonary disease, heart disease, obesity. So you can click on any of those maps and you can click on the legend here. So you can tell here what the national average is from the legend. So if I, for example, zoom in here, I can tell, for example, that if I click on Essex County, Vermont, the estimated prevalence of, I think it's chronic pulmonary, I don't remember exactly, but it's related to the lung COPD, is 10.1, and that's higher than the national average. Similar, for example, Aroostook County, again, COPD is more than the national average. So this can be additional information that you can include, if you really want to go to town with public health data. But my recommendation is that you always start with the asthma and the cancer data at the national level, at the state level. And if you can build your case using those, then you're good to go and you don't need to spend hours and hours going through all this other stuff that's there. The last thing that I want to mention, excuse me, I will just, is the language that you want to use around exposure to hazardous substances, pollutants, and contaminants. It is not reasonable to say that the brownfield sites cause asthma, or they cause birth defects, or they cause cancer, because you cannot really establish like a one-to-one link because the presence of 1 or 2 or 3 brownfields and a particular disease. But the more appropriate language is exposure to contamination from the brownfield sites. For example, it could be asbestos, it could be heavy metals, whatever it is, places an additional burden on the sensitive populations in our target area and may exacerbate adverse health effects such as cancer, such as asthma. So you use a language that talks about how the contaminants for the brownfield sites take a condition that is already worse than normal and make it even worse. And then the grant will help alleviate that additional burden that is placed on your populations. So that's all I kind of like had for today, and I'm happy we have extra time. I'm happy to go back and show you anything that I went through too quickly. I will ask you to evaluate the webinar, please. I will stop sharing right now and put a link in the chat where you can go. It's a very quick, it will take you a minute or two to fill it out. And I'm happy to answer any questions that you have on the public health. And please know that this webinar is being recorded as the other one. So both the PowerPoint and the webinar will be available online on our website so that you can go back and, you know, rewind, see what I did, what kind of language I used, and so on. So any questions? I will also kind of like remind you that we have a two-stage review process where we can look at your data and tell you if they're meaningful or not, you know, if you will get all the points or not. We have two deadlines. One is on Monday for the first round of review, the 16th, and then the second one is November 3rd. If you have draft narratives anytime in between, you can send it us for review, and you can also send us partial things. Like if you just have section 1 and 2, but your section 3 and 4 is not done, just send us those two sections. We'll review them, and then we can review sections 3 and 4 at a later stage. So the more time we have to do this, the more helpful we'll be able to be to you. All right, I see there are no further questions. So thank you very much all for participating. Again, please take a minute to evaluate us, because this is the data that we use for our reports to the EPA. This is kind of like how they, you know, keep supporting us to do the work that we're doing, and this is how we can also be better and figure out how to support you better. So your time and effort is very much appreciated to do that. So thank you very much, and hope to see your draft grants very soon. Good luck with the writing.